so whoever decides. Who's doing it today? Okay, ready?
Yeah.
Alright, so Joseph, how are you feeling today?
Awesome.
Awesome, okay, good. My name is May. I'm going to be your physical therapist. I just want to see how your muscles are doing in your upper back, okay? And I'm going to be putting my hands on you, probably on the right side of your shoulder blade, or your left shoulder blade. Is that going to be okay?
Yeah.
All right. Okay, so 10 seconds, okay? Doing this, okay? So can you just sort of do me a favor? Can you just sort of come towards me a little bit, okay? Remember, you always want to put them at a position that's advantage to you, okay? To let you guys know, that table and this table, they go up and down. Right now, they're unplugged, okay? I just asked either Mr. Mitchell or I to show you how to, plug it in and make it go up and down, okay? All right, so when you're talking about your teres major, what's it doing?
Interrotation.
That's minor. Major.
No, minor is external.
A minor is external rotation, but major is what? Does? What's a good thing that it does?
Extension?
Extension does hyperextension. Okay? Now, it originates at the inferior angle of your scapula. So how do we find the inferior angle of the scapula if it's not that prominent in front of us? Can you sort of put your left hand on the small of your back for me, please? Thank you. Okay, I'll be able to get it. My hands are a little cold today. Are you going to be okay?
Mm-hmm.
All right. So I got his inferior angle. Bring it back and just sort of relax it there. Alrighty? So I'm there already. Okay? So I have his inferior angle. Alright? Now what other muscles are right around that area, you think? Infraspinatus more. Alright, what else? Lats, okay. Are they going to actually say, hi, I'm lats, I'm teres major, I'm teres minor? Or is it going to say something like that? So what you want to do, again, do something that only the teres majors will do. Usually, I do hyperextension because it's just a little bit easier. So I'm at the inferior angle. And when you're palpating near the tendon, so you usually a little bit more easily distinguished, more for the fact there's not too many muscle fibers getting in the way. So I'm gonna, let me go this way. Can you just sort of push up against my hand right here? Good. Alright, and what I feel, alrighty, right here, I can feel his tendons, teres major tendon coming into play, okay? And you're gonna feel it. Again, it takes practice, but that's how you wanna elicit a muscle reaction, okay? Alright, now for teres minor, what does it do? You guys told me external rotation. Now he's in this position, alrighty, and Jin did this, which is external rotation, by the way. Is that a great thing for him to do in that format to get the external rotators to come into play?
In sitting, yes.
Yeah.
In standing, yes.
Okay, so can you sort of put your elbow at the side, kind of thing like that? Are you comfortable?
Yeah.
Yeah, really?
Mm-hmm.
Okay. All right, if he's comfortable, come closer to me. Alrighty. Alrighty. Can you go out a little bit? Okay? And what you would feel, again, for the muscles, because it's right above the teres major, heading towards the shoulder joint. Alright? Now try this. Easy for me. Bend your elbow, go like that. Alrighty? Where's your inferior angle again? Okay? Alrighty, I'm gonna resist this way now. Go into external rotation. Like do this for me, okay? Keep your arm here, but just turn out. Can you do more?
That's about as far.
Oh, that's far. Okay, start in this position then. Okay? Now go up. Go, 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 go. And I could see it coming into play here. And he's also bringing some other stuff coming into play because it's not its only external rotator. Alright? So again, you want to facilitate its action to come out. Okay? Now, I had him in prone to do this. Is there any other position that I would put him in to do this?
Sitting.
Sitting. Okay, sitting is good. What do I need to do as a clinician to watch out for then? If he's just sitting and then he's kind of weak.
Balance.
Lose balance.
He'll lose balance. What may he try to do?
Catch
If you,
yourself.
huh?
Catch yourself.
Huh?
Catch yourself.
He'll catch himself. He might lean a little bit. He might lean downward. Okay. What else may he do? Compensate by how?
For external?
Yeah, put external.
Lean. Oh, yeah, he might lean back.
Lean back a little bit. Okay, what else may he try to do? May.
Side bend?
Possibly. I mean, so that's why this is, again, this is one position. This is the gold standard position. Less for me to worry about what he may try to do. Am I going to have a plinth all the time? Or am I going to have all the time to get him to lay down, make him comfortable? I may want to see something quickly. Alrighty? So again, you want to be aware of saying, hey, alrighty, if I'm going to just see how palpate for the teres minor, teres major, or upper traps, anything like that, I got to make sure he's not compensating. Because if we're doing palpation, and particularly when we start doing goniometry and manual muscle testing, is that going to skew my results a little bit if they start compensating?
Yes.
Very, okay, good. All right, so questions so far? All right, so what we're going to do today, we're just going to do the goniometry part for all 6 of the motions, okay? Actually, more, because, yes, 6 of the motions today. So, you okay to do the whole thing?
Yeah.
Okay, okay. You just sit up for a second, because I'm going to explain everything
Towards
to
you?
him. Yeah, sit like that for now. All right, so we're going to start off doing shoulder flexion. Alrighty, I know I wrote it in the book, supine position. If I wanted to do in sitting, what do I need to watch out for? Leaning back, okay? Because usually if they're gonna bring it up, they're gonna hyperextend their chest. So you need to be aware. If you're gonna be doing it in sitting, alright? For us, okay, what else may we need to watch out for? If you're doing goniometry. Put your hand at your side for me. Okay, don't bend your elbow. Alrighty. Is he starting at 0? You guys can see. No. Okay. So if I wanted to measure him in sitting, what do I need to do to make sure he starts at 0?
Hang it all the way down.
Hang it all the way down.
If he sat closer to the edge.
But then, okay, sit closer to the edge. Okay.
No.
Is he so? No, and is he gonna fall?
Yeah.
He feels like he's gonna fall. Alrighty, because I was getting ready, because he looked like he was gonna fall me. What if he just moved over to one side?
Oh.
Okay. Well, yeah, just sit over here. All the way over to the
Oh.
edge. Okay. Alrighty. And then, boom, he can keep his arm at the side. Okay. Now, for doing this, yeah, I'm gonna have to make sure, okay, that his arm is at the side. Okay. He's not hyperextending his back or flexing forward or side bending, anything. I'm making sure. Alrighty. I have to do more work. Another thing, on the plinth, right? And may I have difficulty aligning the goniometer, alrighty? Because if he's all the way up here, bring it all the way up for me, alrighty? Can I have possible difficulty lining everything up and holding my hand up here? Maybe, alright? Really depends on how high the table is. You can put it down, alrighty? And how short I am or how tall I am in doing this. Okay, because when you're reading it, you want to read it while it's still on the landmarks. Okay, right? You don't want to take it away, because what happens when you take it away possibly? Huh? It can move, and then you got to do it again. Alright, I mean, especially if it moves a lot. If it moves a little, you know, in the clinic, you could probably see where it moved and how much it moved. Okay, but it moves a lot. You just got to do it again. Is your patient going to be willing to do something like that? Maybe, maybe not. Okay, so you need to be aware. Okay, so think of that. Again, like I said, these are gold standard positions. I recommend you doing that for the practical. If you happen to take them out of those positions, I'm going to be expecting you guys to look for every compensation and adjusting for it. What's the take-home message in that?
More to pay attention to.
Yeah, pay attention. Yeah, very good. Alrighty, so, okay, let's start then. Okay, Joseph, how are you today? Good. I'm going to be seeing how well you move your arm, your shoulder today, okay? For me to do that, I'm going to have you do it by yourself, and then I'm going to measure it, and then I'm going to be doing it also, okay? Is that okay with you? Right? I'm going to be measuring with something called a goniometer. Right? All it is just something for me to get a good, a more accurate reading of how much motion you have. Is that okay with you?
Mm-hmm.
Very good. Always make sure it's okay with them. Hey, so can you do me a favor? Can you sort of lay down that way for me? And we're gonna be testing both sides, okay? But we're only gonna be doing everything. Yeah, here. Put your head here. Alrighty. Got this? I need that. I need the stool. Oh, sorry. Lay on your back for me, please. Alright. Alrighty. So, can you just turn your palm up or thumb up, whichever one's a little bit more comfortable for you. Okay? Can you bring it all the way up, above, over your head? Go as far as you can. Very good. Alright, try not to arch your back a little bit, okay? Alright, bring it back down. At that point, I eyeballed it. Alrighty? A little bit less than 180. Probably looking at it, looked like 170. Alright? So I'm going to remember that number. Alright? So actively. Alright? I did it. Now, what else? What could have gotten in the way from him going further? Pillow. So, you want the pillow? No? Here, you know what? Is that more better?
Yeah.
Okay, good. Alrighty. Move it over to the side. Can you do it for me again? Bring your arm up over your head and back down. Good. Alrighty. Good. Very good.
My
And
shoulder doesn't move very good.
okay. Which is fine. They go as far as they can. Okay? So that gives me a better reading. Okay? Now, I'm going to line up my goniometer. Okay? Now, looking at this, looking at his body composition of his trunk and his arm, if I line it up on the lateral aspect of the acromion. Okay? And where are you? Alright. Find the lateral aspect of the acromion. You okay? Ticklish?
Yeah.
Okay. Alright, sorry. Alright. When people are ticklish, you will come across them. Alright? The deeper the pressure, the better. Alright? The lighter pressure, it just makes them worse. Alright? If I line up the goniometer to the landmarks, it's going to give me into the negative aspect. You guys can see it, right? Alright? So I'm going to fix it, alright, by sort of getting him back into zero position. Okay? Allens, can you give me some towels that's behind you?
Sure. Far right.
Thank you. Alright? Just make life easier. Now, yes, I could probably start subtracting everything. Alrighty? But just to make life easier, I'm just going to use a bunch of towels. Okay, can you lift up a little bit? Alright. See the difference, you guys?
Yeah.
Okay? You guys over there, see the difference. Okay, so I'm going to line them up again. I am going to line the proximal arm to the lateral aspect of his thorax, because this is not going to move, okay? So when he's doing the motion, and when I line up, it's going to be starting at the zero position, going up, and to his end position, right? This is your axis or your fulcrum. That's going to be the lateral aspect of the acromion process, alrighty? This black line is going to line up with his humerus to his lateral epicondyle of the humerus. Right? This is his trunk, sorry. This is lining up to his trunk. Alrighty? When it's in the starting position, this will line up to the medial epicondyle, and then you're going to go bring it up and follow him through. Alrighty? Yes or no? Okay? Can you guys see over there? Alright? Okay. Lining everything up. Good. Alrighty. Now, remember what I said about molding. Don't mold. Alright? So as soon as you find it, try to take away like a half an inch or something like that. Alrighty? And maybe a little bit more, because it really depends on the person's body composition and musculature. Alright? You're taking it away. Now, I got his zero position. And his zero position is 0. Alright? So what I'm going to do, I'm going to sort of get ahead of the game. Hold it here and here, right? And just sort of follow him along, right? If you have difficulty following him along because, you know, he's moving too fast or you're moving too slow, you're not in sync, that's okay, because you got his starting number already, all right? So on the count of 3, can you bring it up and over your head again, okay? Don't go too fast or too slow, okay? On the count of 3, 1, 2, 3. Alrighty, keep going, keep going, keep going. You always encourage your patients to keep going. Go, 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 go. And you're gonna have to eyeball it where the acromion went. Is that it? Okay. I'm gonna take it away. And you can put your arm down, relax a little bit, shake it out if you need it. And at this point, he went to 90, 100, 140, 146 degrees. So I eyeballed it a little bit wrong. So originally I thought it was like 170-ish, okay? Now there's a 30-degree difference, okay? That's significant. I mean, if you're talking 2 degrees difference between what you eyeballed and what you actually measured, it's probably not that much. What would I do again if I got 100, if I got the same difference? What would I do?
Do it again.
Yeah, do it again, okay? This is what we call the rule of 3. Actively see what you got, okay, what you think you're gonna get. Second one, all right, is the actual measurement one, all right? The third one, confirm, okay? Just to rule of 3, all right? Just to make sure, because people do weird things, okay? What if he said, I don't want to go anymore?
I don't think you had the towels when you eyeballed it.
No, I did not have the towels when I eyeballed it, okay? So you always want to be careful, okay? Be vigilant about your measurement. So I'm going to do it again one more time. Palm up, okay? You comfortable, more or less? Okay. Alrighty. Line it up again. I still am at 0. Okay, so on the count of 3, 1, 2, 3, bring it up and over your head. Keep going. Go. And yeah, I'm gonna have to sort of keep a mental picture of where that acromion process went, because it does move. Alrighty. Okay. Alright, and relax. This time he went a little bit more. He went to 152. Alright? So looking at between the numbers between 146 and 152, we are in the same general area, right? Why do you think he went a little bit more this time?
He thought he could do better.
He thought he could do better. He actually said, let me go try a little bit harder. Okay? Let me try a little bit harder. Okay? Now, what if you notice he started really arching his back or hyperextending his back when he was doing this?
You can't use that reading. It's not accurate.
It's not accurate. What can I do to sort of fix it in a way?
Verbal cues.
Okay, verbal cues, tell them not to do it. Simply said, bend your knees. That just puts their lower back and pelvis in a good stabilized position. Okay? Just ask them bend their knees, okay? Right? So that is active shoulder flexion. Yes or no? So he started at 0 and went to, we'll say 152. All right? So how would I write that on your notes?
Objective.
Yeah, on your objective section. How would I write it? Somebody go write it on the board. It doesn't matter. This is a learning experience. Somebody go write it. The numbers are 0 to 152, okay? Oof, it's warm in this room today.
It's you.
Yeah. Oh no, really? You guys are not warm? Like you guys are in tanks.
I'm warm.
Yeah. It's warm in this room today. Oh, I can't see it because what is the active range of motion? Shoulder flexion. Is that your little check mark? Yeah. Okay, that's good. 0 to 152. Perfect. That's it. That's all. What side are we looking at?
Right.
Right side. Always want to make sure. Okay. Alrighty. Because how do we know 152 is the end range? How do we know? If he had something, an issue with the right shoulder, because that's what we're measuring, how do we know that's normal for him?
Because he starts at 0.
He starts at 0, alrighty? But how do we always know, like say that 160, 150 area is normal?
Do the other one.
You do the other one, right? You can always compare, alrighty? Because say, for example, what if it's like 95 is his normal, alrighty? How do we know? Because that's really far away now. But if his other side is 95, okay. Either both sides there's an issue, or both sides that's normal. So you always want to compare, alrighty? On the exam, you're not going to be doing that because, well, for that fact, time. Okay, we have way too much, you know, I don't want to spend too much time there. But you always want to compare it to the other side. Whatever you do on one side, you always want to make sure you do it on the other side to make sure, so you have a comparison. Does that make sense? All right, whether you're doing manual muscle testing or taking somebody's heart rate or blood pressure, right? It can be variable. It can be variable on each side. Yes or no? All right? Okay, so if I wanted to passively do it, what's my first thing I would do?
Talk to him.
Talk down, okay? Joey, I'm gonna move your shoulder now in the same direction. Okay? I want you to try to relax as much as possible, okay? When I'm nearing the end, right, I'm just gonna give it a little nudge. Is that gonna be okay with you? Okay? All right, I'm gonna just grab you from here, okay? By the right above the elbow and right above the wrist, okay? All right, try to relax as much as you can. And I'm just gonna bring it up, all right, and give him a good stretch at the end. What do you feel as I'm pushing? Yeah. Right there. Alright, I'm giving him a nice stretch in these muscles here. Alright, and what I'm feeling for, when I gave him that give, alright, gave him that little push, do I feel that normal end feel? Do I feel something bounce back at me? And Elizabeth, do you see that? Come right back up. It actually does bounce back. So it does feel a bounce back, okay? If it's a soft end feel, what do you think I would feel? Not bounce. Very good, not bounce. But what would you feel?
You can just less resistance.
Less resistance, just like mush, okay? Just like mush, like a pillow, like you're giving a pillow a hug, okay? Alright, a hard end field. What do you think? If I went for, I'm gonna jump ahead to elbow extension now. If I went like that, alrighty, and I gave him a push, what would I feel? You okay? Alright. Well, not even resistance. I would feel
Bone on bone.
bone on bone. It would not move. Right? Right. There's a few of them in the body. There's elbow extension. Knee extension. Yeah, knee extension. Yeah, there are exceptions to the rule with knee extension these days. Definitely right. Right ankle eversion. Yeah, eversion and. Radial deviation, okay? Those are the definites, okay? Knee extension's a little bit iffy because it really depends on the person's knee. Because when we talk about knees, you'll see why. Okay, so that is for shoulder flexion, alrighty? Now, I'm gonna do shoulder abduction right now. More of fact, he's in the supine position, okay? So, we good? Alright, so for shoulder abduction, this is the exact same position that he would be in. Alrighty? What do you think I would ask him to do? You tell me.
Side left.
No, this is the position. Alright, this is the position. So what would you ask him to do?
Not to bring his shoulder to his head.
Okay, not to bring his shoulders to his head. Alright, shrug his shoulders. But what would you tell him to do then? Relax. And can you move? Arm. Come on.
Out and up.
Out and up. Yeah. Very simple. At this point, do I need the towels, you think? No, because he's probably going to knock them down. Okay, so keeping your palm up like that, can you bring your arm up and out for me, please? Okay? Go ahead. All right, go, 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 go. Very good. Bring it back. Alright, keeping in mind, okay, I'm going to say like 160-ish or so, okay? Alrighty, so looking at my landmarks here, okay, I'm going to use the anterior aspect of the acromion process because remember, you always want to use bony landmarks as much as possible because they move, right, but they're not going to disappear on you, right? So I'm going to find his anterior aspect of the acromion process, okay? Right, which is right here. It's not on the glenoid, not the glenoid, the humeral head, but I feel is a acromion process. Alrighty, I'm gonna line up the proximal arm or the non-moving arm with the midline of the humerus. right? And I'm gonna pick an arbitrary spot that says it's gonna be the midline, okay? Because I'll use his elbow joint. Can you just bend your elbow for a second? Okay? And I'm just gonna pick that spot, put it down, and I'm gonna remember it. Alrighty? His non-moving arm, his moving arm is gonna be lined up to that point, and I'm gonna follow it long. I'm gonna use the anterior aspect of his trunk, keeping it parallel for his non-moving arm. Does that make sense?
Can you
Okay?
repeat that one more time?
His acromion process is his axis of fulcrum, righty? Lining up the moving arm with the midline of the humerus, righty? Picture where his humerus is. It is in the body, righty? His non-moving arm, or the proximal arm, is going to be parallel to the trunk. You could use the sternum as a guideline, or just the trunk. Alrighty? Yes or no?
Yes.
Okay, so I'm going to line them up, and you can see where the anterior aspect of the acromion process for him is. It's not on the glenoid on him at all. It's a little bit superior, so you can see, you guys can see, it's right there. Yes or no? It's like a little bit off if you look straight down at it. Okay? Alrighty? So, using the midline of the humerus, okay, I'm going to line up the little guy, the little moving arm. This, the proximal arm, the one underneath, okay, is going to line up with the lateral trunk. I'm going to take it away up a little bit from his arm per se, so because people don't like stuff there. Alrighty. Now, I'm going to need to be over here, right? Because I'm going to get myself in a position of readiness because I don't want to get in his way of the smooth movement, okay? So I'm going to have